Hello, my name is Pakwanja Twea. I am a PhD candidate at the University of Bergen at BCEPS, and today I will take you through a very brief introduction to health service costing. We'll start by giving some definitions. So cost is the value of resources used to produce goods and services, and there are different definitions of costs. You have financial cost, which is the acquisition price of the product, including the cost of financing minus depreciation. And you have economic cost, which is the value of resource in its next best use. And the economic cost definition is based on the principle of scarcity, understanding that we have limited resources but unlimited ones. So we have to make decisions on allocating resources. But by making those decisions, we exclude other uses of those same resources. So this is the definition of cost that we'll be using throughout our presentation. So to start with, when you're conducting your costing analysis, you have to start by defining the scope of the cost analysis. It is very important that you define the scope because it will determine how you conduct the cost analysis itself. So you start by defining your objective, and that is the purpose for which you want to undertake the cost analysis. And there could be different objectives that could be applicable. You might want to understand the cost of illness. You might want to understand the unit cost of providing a service. Say you want to understand the cost per hour of nurse time or doctor time. Or you might want to understand or compare the cost between different providers or even different geographical areas. It is also important that you define the perspective from which you are conducting the study, and that is the viewpoint from which you are conducting the study. You could take different perspectives in undertaking your cost analysis. You could take the patient perspective, in which case you're only accounting for the costs that have been borne by the patient, or the provider perspective, in which case you're only accounting for the costs that have been borne by the provider. You could also take a more encompassing society perspective, in which case you are calculating the total cost of providing the service, regardless of who has borne the cost. And this tends to be a more encompassing way of measuring costs, and it also includes externalities that come with the provision of that services, whether they are positive or negative. You also have to define the time horizon, that is the time period over which you are estimating resource use. And again, this is very important because it will help you to determine which costs are relevant when you're conducting your cost analysis. It is also very important that you determine or establish or define your cost objective, and this is very important because again it will help you to determine the relevance of costs that need to be included. So the cost object is the entity for which you are estimating the costs, and it can be different things. It can be an organization, it can be a hospital, it can be a department within a hospital, or it can be a service or intervention. Whatever the case may be, you need to ensure that your cost object is very specific and aligns with the cost objective that you've defined. So for instance, if your objective was to compare costs between providers, you want to make sure that your cost objective is stated in such a way that makes it comparable between different providers. So with having established the scope of your cost analysis, you can go ahead and start with the costing process itself. So the costing process will have 3 steps. The first step is to identify and classify resource use. The second step is to measure resource use. And the final step is to attach a monetary value to the resources that have been used. And I will talk about each of these in turn. So starting with identification and classification of resources, the first thing you want to do is to make sure that you have identified all relevant resources. I emphasize relevant here because this is determined by the scope that you've already defined. So what will be considered relevant to your study will depend on your time horizon, it will depend on your perspective, it will depend on your objective, and it will depend on how you've defined your cost object. In any case, you need to make sure that all of the scope have been so well defined as to help you to be able to correctly identify all relevant resources. And there are several tools that you could use to identify the resources that go into the production process. You could use clinical management pathway descriptions, which are available for most services. You could use standard protocols and guidelines if you want to conduct a normative cost, or you could use focus group discussions with either patients or providers and other interviews. And you could also directly measure or identify the resources as they're being provided. You also want to classify and code all resources, and there are different classifications that can be used. I've stated a few here. You could use a direct, you could classify your resources as either direct. These are the resources that directly go into the provision of a service, or indirect resources. These are incurred because you have to access the resources. They are incurred because you have to access the service, but they're not part of the direct provision of service. Or you can classify them as either capital recurrent or fixed or variable. And this becomes important also depending on the time horizon that you have chosen. Once you've identified and classified resources, you can go ahead to measure them. And there are different approaches here. I'll start with the approaches. You can take a retrospective approach, in which case you're looking backward at resources that have already been used and services that have already been provided, and trying to determine how much or which resources have been used and in what quantities. Whereas the prospective approach is forward-looking and looks at the resources as they are being, the services is being provided and the resources that are going into the provision of that service. There are also different costing methodologies that can be used. I talk about two here. The top-down method, also known as gross costing, tends to look at the total cost of the service. So for instance, if you're looking at the hospital, you look at the total cost at the hospital level and then try to work that down to your cost object. Whereas the bottom-up or micro-costing approach starts from below. So it starts at the unit that you are interested in, at the service, the provision of the service level, and gives a very detailed estimate of each input that goes into the provision of that service, and then through repeated measurement tries to come up with an average, considering that patients are heterogeneous and patient use of resources cannot be the same. Or you could do a mixed methods, in which case you are combining top-down and bottom-up according to availability of resources and preference, also determined by the scope of the study that you've previously established. In terms of measuring resource use, this is a continuation of the identification part, because you can use the very same methods to identify and then measure. So for instance, if you're using direct measurement, then as you are directly observing the inputs or the resources that go into the production process, you can also measure the quantities that are being used as part of the provision of that service. If you're looking at prospective studies, you can go back and look at medical records and try to determine the resources that have been used and the quantities that have been used. You can also use interviews or facility questionnaires. In any case, there are some considerations that you have to make when deciding on the method. You can think of feasibility in terms of time and costs. Top-down methods tend to be less costly and take less time, but come at the cost of accuracy and precision, whereas bottom-up or micro-costing approaches can be more precise and accurate, but more costly and take more time. All of the decisions in terms of the costing methodology that you have to that you use will also be determined by the scope as you've defined it earlier. And I just wanted to mention that for each of the costing methodologies, there are several more examples of the exact methodologies that you can use. You can use time-driven activity-based costing, and other methods that you can use after you've decided on the costing methodology to precisely determine the resources that go into the production process and to measure them. And finally, we'll talk about the resource valuation, or trying to attach a monetary value to the resources that have gone into the production process. And again, like we've discussed previously, you can use direct measurement here, or you can use market prices. In some cases, you might need to adjust market prices because market prices are not always equal to economic costs. Or you can use fees or charges by the hospital, in which case you are looking at the costs that have been charged by the hospital as your cost. Again, you might need to adjust the cost here if, for instance, the hospital is profit-making or is heavily subsidized, then you have to adjust the prices to reflect the actual price or the actual cost of those resources that have been used. Or you can use official cost databases, which is available for most countries, or you can estimate or extrapolate from the literature. So in terms of resource valuation, a key consideration that you have to consider is, and I'll talk about two here, is time preference. Understanding that for most people will value resources now than in the future. So to account for this difference, you have to apply discounting methods, and you have to decide on a discount rate that is applicable to the setting that you are using. And finally, you also have to adjust for inflation, particularly if you're looking at a longer time horizon, and understanding that costs may be different if they've been measured in different periods, even if it's the same cost and the same quantity. So this is the end of my presentation. This is only an introduction, and we have added a link with some recommended reading if you want to study this topic further and you want to conduct a cost analysis yourself. Thank you.